Infertility Examination Guide. Hello, this visual guide was produced to explain about the definition of infertility, its cause, types of sterility examination and its process. Refer to the following information, and please cooperate for a precise examination to be done. Women's menstrual cycle and process of pregnancy. To understand about infertility, first, you need to know about women's menstrual cycle and process of pregnancy. Women's menstrual cycle. Women's menstrual cycle normally repeats itself about 28 days period by hormones secreted from pituitary gland and ovary. Ovulation, which releases egg, occurs about 14 to 15 days after the first day of menstrual cycle. Pituitary gland releases gonadotropin, which stimulates the production of estrogen from ovary, and estrogen stimulates the development of uterus. About 14 days after the start of menstrual cycle, the level of gonadotropin hormone surges, and ovulation starts. After ovulation, a corpus luteum is formed in ovary, and it releases luteinizing hormone called progesterone in order to maintain and thicken the lining of uterus. If you get pregnant at this time, corpus luteum will continuously produce progesterone and maintain pregnancy. However, if pregnancy is not achieved, menstrual cycle will begin as corpus luteum will contract rapidly and endometrium will fall out due to decreased progesterone. Process of normal pregnancy. When sperm comes into women's body in days before or after ovulation, 14 days after the start of the menstruation cycle, sperm and egg are met in fallopian tube and fertilization occurs. Then, the fertilized egg undergoes cell division and then implanted to the wall of uterus, forming gestation sac and placenta to develop embryo. The concept and cause of infertility. Infertility is the case which a couple cannot conceive a child when the couple had a normal married life over a year, without contraception. The possibility of pregnancy decreases as a couple ages, so that when a person suffered a disease in the past, increases the possibility of infertility, and women over 30 could not conceive a child over 6 months should consult with infertility specialist doctor for close examination and receive treatment. The cause of infertility is either come from male and female, and sometimes about 10%, there is no clear cause of infertility. Female cause of infertility is mostly from abnormal hormone level, ovulation failure, intra-abdominal adhesion, and sometimes it comes from malformation of uterus, intrauterine adhesion, abnormality of cervical mucus that sperm passes through, antibodies against sperm, and endometriosis, etc. Male cause of infertility is mostly from low count of sperm and low mobility of sperm, and from abnormal formation of sperm, close of spermy duct, varicocele, sexual dysfunction, etc. Preparation before examination. If you come to the hospital first time for the consultation about infertility, remember your menstruation period and visit hospital 2 to 3 days after next menstruation period starts. Visiting hospital, please avoid heavy makeup and nail polish, and wear comfortable clothes for examination. Women's infertility test. Infertility test and treatment is usually carried out based on women's menstruation cycle, so that basal body temperature chart should be written. Basal body temperature should be measured every day by mouth, not by measured right after waking up from sleep. After ovulation, progesterone secreted from a corpus luteum increases body temperature. Filling out body temperature chart starting from the first day of menstruation cycle will give the date of ovulation and also give the information whether the menstruation cycle remains normally or not. Consultation, examination and checkup. Through consultation with physician, check previous medical history, and get basic tests such as physical examination, gynecological examination, cervical cancer screening, breast radiography, blood test, urine test, etc. Hormone test. 2 to 3 days before menstruation, examine hormone level which influences ovulation and pregnancy by undergoing blood test. Ultrasound. 2 to 3 days after menstruation, get an ultrasound to check up abnormalities in uterus and ovary. Have an additional ultrasound in time for ovulation to check ovarian status and the size of ovarian follicle. Biopsy of the wall of uterus. The wall of uterus is thickened by hormone until the start of menstruation in order to be implanted to uterus. Take tissues of the wall of uterus several days before menstruation and observe those tissues by using endoscopy. Endometrial proliferation influenced by hormone can be observed. Hysterosalpingography. This test is run between days after menstruation and ovulation date. By instilling contrast medium that radiation doesn't penetrate through inside of uterus and imaging a radiograph, it enables us to confirm closeness of fallopian tube, malformation uterus or abnormality of uterus, etc. Examination after sexual intercourse. After several days of abstinence, having sexual intercourse on the date of next ovulation, and suctioning mucus of uterus for checking the sperm count and mobility of sperm in the mucus through microscopy. Examination after sexual intercourse requires mucus to be collected within 8 hours, so have sexual intercourse a day before visiting hospital. It is fairly safe to take a shower after intercourse, but do not use soap or antiseptic solution to bathe one's private part. Hysteroscopy, laparoscopy. These tests are run if there was a suspicion or necessity to be performed. It checks abnormality and surgically treats it at the same time. Hysteroscopy is done by filling the inside of uterus with saline solution and inserting endoscope to check for abnormality and correct by performing surgery on polyps, myoma, adhesion in uterus, or deformity that may be the cause of infertility. Laparoscopy is done by injecting gas within the abdominal cavity and by creating a small incision on skin to insert laparoscope to check for anomaly within pelvis and correct by performing surgery on adhesion in abdominal cavity, endometriosis, hydrosalpinx by fallopian tubes being blocked and filled with fluid, or myoma in uterus that may be the cause of infertility. Men infertility test. A cause of infertility is also heavily from men. So it is recommended that a couple goes through infertility test together. Semen analysis. This test is the most basic infertility test. Semen is collected in a sterilized container. To check amount of semen and the number of sperm and its mobility and shape within 1 hour, the test is repeated in a certain interval. Sperm function test. It is also called sperm penetration test that cultivates hamster's ovum, which zona pellucid has been removed with men's sperm to measure sperm penetration. Anti-sperm antibody test. This test is to check whether anti-sperm antibody which damages man's sperm is present in blood or secretion of men or women. To have an accurate infertility test in successful pregnancy, it requires a considerable time and effort, so that a couple needs to have a firm determination and attitude that they will cope with the difficulties together. Infertility could be from multiple causes, so when suspicious abnormalities are observed during tests, tests for other causes need to be completed. Until now, we have explained about sterility examination types and its process. Thank you.